So welcome everyone. I am the AAEM Western Regional Representative of the RSA Medical Student Council Board or Medical Student Council. And I'm very happy to see you all. There was a huge turnout for tonight, and I think there's more coming. We also got your questions, so we're gonna get to those shortly, but I think we'll start with some introductions. And I'm really excited that it's I believe all female panel, which is really cool. And so I'll start with myself. So I'm Kirsty Velarde. I'm from California. I'm a non-traditional student, a fourth year medical student at Western University. So I will be a DO in just a few months. I'm excited. And I did both in-state and out-of-state aways. So feel free to ask me questions about that. I also have a significant other and a daughter, and they came with me on my aways. So also feel free to ask questions about that. The one thing I do want to ask our panelists when they introduce themselves is maybe some big takeaways. So my big takeaways were ask for feedback, be self-directed, and not overly apologetic or annoying, but you guys have probably heard that. And so I'm going to start with Carla, if you want to introduce yourself.
Sure. Hi, everyone. My name is Carla Villafan. I am a fourth year student, also coming out of Western University in Pomona. So just weeks away from finding out match. Very exciting time for us. Let's see. The biggest takeaway I would say for way rotations is be enthusiastic, but not annoying enthusiastic, but sincere enthusiastic. Find what you like, and then go with it. But I'll elaborate on that later.
And then Danielle, if you want to go ahead.
All right. Hi, everyone. My name is Danielle. I am also a fourth year at Loyola University Chicago Stern School of Medicine. And yeah, I mean, I think my biggest takeaway is, very, very similar to what's already been said for sure. If I had to say something different, it would be, you've made it this far, and like you have studied, you have worked for this, and this is what you want. You got to make sure you have confidence in yourself. And even if you're wrong, standing behind what you say carries a lot, because it's okay to be wrong. They don't expect you to know everything at all. Like they especially don't expect you to know very much, to be honest. And so just making sure that you do the best that you can and exude confidence with whatever you're doing, I think is critical, because if you come off like wishy-washy, then, that can cause a little bit of like, oh, she's not confident, she's not, kind of hesitant. And that can like lead to more negative perceptions of you, even if you say the right answer, you know what I mean? So that would be my biggest takeaway that I had to learn for myself for sure.
Great. No, those are all really good pieces of advice. And you guys will probably see some similar themes coming through. And we were all in your guys' shoes. We all went to panels like these and like heard things like don't be annoying and ask for feedback. And so, yeah, just hitting those points home, definitely. All right. So you guys submitted some great questions. I'm going to start there so that I make sure to hit those before we run out of time. And then I also have some questions that I felt were pertinent to bring out some good information. But if you guys come up with a question, feel free to shoot it in the chat. I will be monitoring that. So the first couple, I think 10 questions will be just kind of random, but they're your questions, so they're really important. The first one being, could you talk about the letters of rec that we can submit with VSAS? I did this, so I will speak to that, but I want to give everyone else a chance first. So let's start with Danielle. Did you do this?
Yes, I did. Not all of the programs that I applied to for aways required a letter of recommendation, but the ones that did, I ended up getting it from. So the thing is, in my perspective, like the letter of rec is not nearly like as important per se in terms of like whether you get that acceptance or not for it to do an away. So because it's kind of like a standardized thing for some programs that require it. Like I went to one of my faculty members that I had developed a relationship with, and he had told me like, oh, I already know, like some people need this. I already have a template out, and then he just kind of like sends it out there. So I feel like because this is super common for the process, like going to either your clerkship director or your program director, if you have a relationship with that person, or just someone in EM. I do think it has to be someone in EM, even if you haven't had your EM clerkship yet, or like your home rotation yet, and I had not at that time, but just someone who can speak to you, ideally in the specialty. That's what I did, and that's what I.
I hadn't thought about doing that way. That's really smart. And I think that's a good point that you brought up. These letters usually have to be acquired before you've even had, a community site rotation with EM or EM related anything. So that's one way to go about it. Carla, did you do a VSAS letter of recommendation?
So I actually avoided VSAS completely. I would not recommend that because it is obviously like 80% of all programs are going to go through VSAS. You're limiting yourself by doing that. I just didn't have to. Ultimately, I found enough rotations. And since we were so limited, it was reported that we shouldn't do any more than 2 rotations, 1 away, 2 if you were an orphan school like Western U is. So honestly, I didn't have to do it, but I would just go ahead and start working on figuring out who's going to write you those letters. You're never going to have too many letters. So giving somebody a heads up that you're going to need a letter is a good idea. I mean, you may need it for a scholarship last minute. You may need it for anything. Just, it's good to have letters.
Yeah, that's true. And I had heard from our upperclassmen when we were third years that if you didn't have a letter, that might be an issue for some of your ways. So I did want to get a letter. I went about it a little differently though. I got a OSLO, and I think they're still doing it this year. That was started a few years back with COVID. But I got an OSLO, or I was planning to get one from actually my acute psych rotation. It was like a county program at UCLA that does like, it was for my psych requirement. But since I thought there was some overlap and it was just kind of convenient, I asked the person to do a SLO or the OSLO, but I also asked them to write a letter in support of my VSAS application. They felt actually much more comfortable with the format of the VSAS letter than the OSLO, because people in other specialties are like, what is this? I think she even like hand wrote it on a PDF. So it looked really funny, but that was a whole different thing. For the letter that to like upload, that was easier for her. And she had offered like, if you need any support in a letter beforehand. So I was lucky in that way. But I feel like even, and I've heard this, even if you're a few months out from a rotation for where you think, okay, there's some EM overlap, you can go back and say, hey, I need this letter for like my VSAS. And I've heard people have success even calling back to 3 months, 4 months before and getting that, if you're kind of like, oh, I wish I would have. So you can try that. All right. I'm gonna move on. The next question that we got was, what advice do you have regarding scheduling or timing of away rotations? What were the most unexpected lessons you learned in your experience? So I laugh because I've learned a lot in this, but I'm gonna start with Carla, do you want to start?
So my very first away rotation was, gosh, since I was kind of off track, it was like my very first rotation. And it was in the middle of, or no, it was at the end technically of third year. I had barely reached the requirements, but it was really, really nice to do one early because this program hadn't seen anyone rotating yet. They were kind of tired of the crew that had come in there. No one was interested in EM. They were kind of being their new program. And so honestly, take advantage of these new programs that are out there, go in there, kind of get your feet wet and get comfortable with the EM atmosphere. If you do have the liberty of doing more than 2 rotations, which I think they should open it up next year, and they don't really tally it. No one's tallying it anyway. So go ahead and go out there and get your rotations and get as many as you can. But honestly, it felt good because it was almost like I could kind of be an idiot, like at end of my third year, I'm still an idiot, it's fine. But they were like helping me. They were like, oh, so you're interested in EM, and here's what really makes people stand out. And all their advice was true. Like it was such good advice. And I just like went with it, and it followed me through to my last rotation, which was just a couple months ago. So I would say the one thing to add that people don't usually get is Don't limit yourself to a certain period of when to do these rotations. Like really early, late, doesn't matter. Like we're not submitting our ranking until this month. And if you can benefit from being at a location, if you can benefit from being at a location where you are like, you know, I'm kind of figuring out whether or not this is the program that I want, it's a good experience. It's good no matter what. So just do as many as you can.
Yeah. And I'm gonna jump in because I also think that what a really good piece of advice is, if you guys are limited to your away rotations, you can still do like ultrasound EM rotations and other rotations that are like EM adjacent. So that was one tip I got from the previous year who really got hit by the pandemic and the restrictions. So that's something to think about. And also, the first rotation I know I did was the community at the end of EM, which I did get a slow for, but the ones that they really want and are really weighted are like the residency based EM rotations. So I would say what she's saying, timing is like less important than you may think, but what is important is getting at least one slow in, if not two, by the time that you're clicking submit. You can always update them with a second, but get that minimum slow in so that you're not, or try to. I mean, you can't control everything, but I've heard good, bad, and different things about that. But it's good to, you know, have a slow on there when you submit. All right, Danielle, anything else to add?
Yeah, definitely. So I completely agree that, you know, at the end of the day, like whenever you get your away rotation, whenever you can do your away rotations, and that's the best time to do it. I think we trying to have at least one to at least when by the time you submit your ERAS is really, really helpful. And so for me, I did my, so I had my home rotation in June, and I was also fortunate to be able to do my away rotation in July right after. And at first I was really nervous about that because I ideally wanted to use July to study for step 2. So that way I was like, oh, okay, I have this like medicine knowledge in my head and I'm ready to like go down to, you know, like go to town as soon as I go to my away rotation in August. But then I had a conversation with one of my mentors, and you know, she was saying that, to be honest, if you do have the opportunity to do one after the other, for us, we had a max, like for my school, I could only do one away rotation, and no, like, unless it was a virtual thing, I wasn't allowed to do OSLOs either, in terms of like unless it was in-house or unless it was virtual, I couldn't go anywhere more than once. That was just my school's regulation. Hopefully it's not that restricted for y'all, but what's it called? Yeah, so my mentor, she was saying that if you have the opportunity to do your away after your rotation back to back, to be honest, that's probably to your benefit, at least for me, in which, you know, related to my advice, where confidence, I was definitely a little more like timid, nervous a little bit during my home rotation. That came up on my evals, being like, you're saying the right stuff. You just need to say it with more oomph. And so, to be honest, my home rotation was really how I kind of like, you know, dusted off the cobwebs, and I was like, okay, I'm getting a flow, I'm getting a motion, and like I got a rhythm going. So that momentum carried through to my away rotation and allowed me to be a lot more confident because I was still seeing the exact same stuff, and then was more familiar about how to like be useful in the ED by the time I got to my away rotation. So having that momentum carry, I think, was a really huge benefit for me, because I didn't have any breaks in there. You know, like it's great to study for step 2, and I think I would have done fine if I studied for step 2 first. But at the same time, like having a whole month of nothing clinical, like, I mean, I'm just comparing to right now. I haven't been in the hospital for months, and I'm just like, I don't know what a patient exam is anymore. So like, some time, okay? So like my momentum has plummeted. That's the benefit of 4 years.
Yeah.
But yeah, so I think that's a plus to doing it back to back whenever you can do that. So that's personally what I would recommend. Then you can do 2 before your ERAS is due. I personally recommend it because a lot of programs, they want that. They want more, they want your application to be as complete as possible if you can, but if you can't, it's okay.
Yeah, no, I'll agree with that. I actually did kind of the opposite. I had a community rotation before I knew about the restrictions. And then I had 2 away since we were from an orphan status program where we didn't have an in-house rotation. So with that, I mean, there's benefits and disadvantages, however you want to look at it. But the point is, I did it the opposite, where I took time off to study for STEP. And the downside to that is you may not be ready. And I actually took my STEP like, because we did like level first, and then I started my away rotation in Chicago, and then like after a week I took like my second like I took STEP, or the other way around, I can't even remember, it was all a blur. But that anxiety falls into that away rotation if you don't do everything on time, so that's also the risk you're running. It turned out fine for me, but I wasn't the only one, and that my first away was in July, like mid-July or beginning of August. And so I wasn't the only one in that predicament. And so that's the risk you're running. But I agree with her that the momentum was huge, because I was way better on my second away or my second rotation than the first. And then with that, I also want to add that if you don't have that second academic slow, like I didn't have my second academic slow. I had a couple slows, including the one residency-based slow in there. And then so I, good or bad, was able to update schools or update programs and say, here's a slow, which is always a good reason to write a letter or write an update. And I've heard, do that with your top 10 that you haven't heard from, let's say a month in or something. So it's a good thing to have, but it's not like, it didn't get me a lot more interviews than I originally had. So, but everyone's different. So that's a thing. Okay. I think we can move on to the next one. Oh, unexpected lessons on that last thing. Don't forget to advocate for yourself. So I hadn't heard back from my summer away, and I had applied to quite a few, and I had started making calls. And because I made a phone call, the scheduler was so nice. She was like, let me talk to someone. And then she called back. She's like, because you called, I'm going to get you that rotation. So don't be annoying. Don't call every week. But like, if it's a month out that you're hoping to start there, give them a call and or like I say a month arbitrarily, but like give them a call to say, hey, I haven't heard from you. And that shows them, okay, this random person from California actually does want to go here. Like they're showing me that interest. And so don't freak out if you haven't, but know that people aren't just going to give you rotations necessarily. Okay, moving on. How important is it to have 2 slows versus one when submitting? So we kind of addressed this on September 15th. So I think for our group, it was like the end of September, we had to click submit. They changed it a little bit. But I had 2 slows, again, only one being an academic one, and then updated with the other one. Anyone else have anything to add to this?
I also had just one official slow, and then I had a community-based program EM physician write me another one. I forget how they subtype it. And then I had an ultrasound EM rotation slow. So that's like a different subtype. So yeah, only 2 of them made it by the time the actual official date of submission came through. But the other one, I was applying to the program. It was kind of nice for me to like ask for the letter of recommendation, for them to get their thoughts together, for them to recognize that I'm applying to their program and I'm there showing up every day. Sometimes I just think that was just the only reason for that slow.
Yeah. Danielle?
Yeah, I had both of my slows in by time I pressed submit on the first day. I do think that if you can't, I think we had touched on this a little bit. If you can get them both, then that's great. If you can get them from, places that have residency programs, that's ideal. But there are tons of ways to make sure there are tons of ways to work around that if that's not your situation, and it's not necessarily good or bad. It's just different, and that's totally fine. Whatever, I think that it's going to work out either way, and there's so much benefit to any type of slow that you're getting. Like when you're doing your rotations, that's what they're looking for in your application.
Yeah. And I think some of the programs will say, the ones from the residency programs, those are the ones we care about. And I can see that. But having an extra letter or something, because I didn't know how long it would take my away to get in my first academic slow. That's why I was sure to get a non-academic slow. The other reason is I had a mentor in EM from UCLA saying, I don't mind when there are other rotations in EM. I only ask why there's not a letter if they do another rotation. So if you're doing another rotation in EM that's not an academic letter, I would still consider getting a slow, because you don't want them having any questions unanswered. Like I had a community letter first, or a community slow. So yeah, it may not be weighted the same, but it won't leave them to be like, why didn't they ask for a slow? And by the way, if any of you guys are doing EM rotations at the end of third year, I asked and they were like, we normally only do it for fourth year. And then I explained the situation that like, it may be a deficit if I didn't have, and I did really well in the rotation. So they then reconsidered. So don't like be annoying, but definitely like explain that side of it if you have to. Okay. Oh, and I also heard from that same mentor, like, you don't have to do perfect on the first one. I'm looking for the upward trajectory. So don't get out of your head insane about having only honors. Yes, try to get honors, but like one of my rotations, they give everyone a pass because people were so anxious about it. Like they either do pass or no pass. So there's different systems. Okay, next one. Tips to getting adjusted with writing notes on addition, especially when note writing was not allowed during a third year rotation. I'm gonna interpret that as like, you're going to a new place and how do I write notes well or fast enough? And I'm not sure about during the third year rotation part, but if you want to clarify, add it in the chat. Anyone want to get this started? I'll open it to either of you guys.
I just want to say, as far as with anything, any particular thing on any rotation, what you were saying, like show the upward trend. So sometimes I just use this to my advantage. So first week, that's your learning week. That's your only time to really mess up. So if
and
your
you
notes,
will.
And you will, yeah. If your notes are terrible during that first week, they're terrible. It's just going to show a bigger jump from fourth week or from the fourth week. So you want to make sure that there is a jump though. If you know that your notes are lacking, do whatever you need to do. Take your extra time and look at other people's notes, look at other patient charts, see what it looks like. You want to get the lingo down, you want to get, the substance down. Every location is different, even within EM. And every physician is going to be different. So you want to make sure that you get a decent looking intern level note by your fourth week, so that it looks like, okay, I'm ready for this, especially if it's, you're not a fresh fourth year, but you're well into your fourth year. You need to start producing intern level work. So that's what they're looking for. Can we see you in the role of an intern in our facility? That's it. But if you suck the first week, that's fine.
And ask for feedback, because some rotations, they won't be like auditing your notes until later. So let's say you're worried that your notes aren't very good, like ask for feedback, but find the right time to ask for that. Danielle, anything else?
Yeah, I definitely echo what everyone said so far. I had to do that. There were some things that I was just really not good at. I was able to write notes during my third year clerkships. But the thing is, like, when you're going through the layer rotation, like they can be formatted differently. The things that they wanted to do can be structured differently. To be honest, I was very upfront. If I didn't know how to do something, I was like, hey, so I'm letting you know right now, I don't have a lot of experience in X and I would like to learn. That was my gateway to be like, hey, so if I suck, I'm just letting you know, I told you in advance, you know what I mean? So like, teach me, show me how to get better. But then if you're going to bring that up and be upfront about it, you better make sure that you improve, so you better make sure that you have that upward trend by the end of it. And so if for whoever asked that question, like if you do not have experience with writing notes, first day, when you're on shift, be like, hey, I'm just letting you know this was the situation at my school. And so I want to know, like, what are the expectations for me in terms of writing notes? That's a big thing. Ask for expectations, like the first day, anytime you're working with a new patient or new resident or attending or whoever you're working with that day. Make sure you ask, what are their expectations? What do they want to see with you? And then if there's something you want to grow in, and if it happens to be note writing, bring that up, be like, I would love to work on this. And so can you give me some feedback, how you think it should be structured, and take a look when I'm done, that kind of stuff. And that shows that you are you are willing to put in effort to grow and get better. And that's what they want to see. Because again, they don't expect you to be perfect. They expect us to not know anything, but they want to see that you want to improve and work hard to get better.
Right. And I think there was an advantage for me in having the community rotation at the during my third year, because they actually sat down and went over notes with me. But that being said, I still got reamed for notes before, like in my fourth year rotations. Not reamed like this is the worst note ever, but reamed like legally this would be like an issue if you write it this way versus this way. And that's a work in progress. Like residents are learning, so they're teaching you what they're learning. And just remember though, don't like stop their flow to ask for that feedback. Usually towards the end of the shift, I always was like, I want to ask for feedback. Is there a good time? And they would tell me like, let me finish these like 3 things I got to do, and then I can make some time for you. So like, and if you feel like note writing is something you want to bring up during that, great. And maybe they'll get to it later that night and like find a way to message you or meet you again. I don't know, but there's just like, make sure to be on their terms and be helpful and not interrupt them, because they're already getting so many interruptions, you know? Okay. So the next one is, latest month to complete an EM away rotation for a slow. Oh, I'm glad somebody brought up resources, because I already have, I'm putting mine in. I have put mine in the chat, but we'll talk about them. Resources to impress during EM away rotations. How many EM? Okay, so let's break it down. There's a couple questions here. So the latest month to complete an EM away rotation, I feel like is subjective. So I did ones that were a little late, but they still served me well. I still interviewed like later in the fall at a program that I like rotated at later in the fall. So that is subjective, but if you want your slow to count, I mean, either before clicking submit or like, I would say the month after, because I got a very few extra interviews towards the end of the cycle and most in the beginning and the middle. And also if you guys haven't heard from anyone during like, didn't hear much during like December and I kind of freaked out, that's okay. Like it'll pick back up or you can reach out. So there's different things. Anyone want to jump on that part of the question? When's the last month to complete an EM away rotation for a slow? Carla, Danielle, anyone?
Okay, I mentioned earlier, sorry, Danielle, I mentioned earlier that I don't think that there is a latest. Obviously, you have to get your slow in. I think you've got to get at least 1 in before you submit, so that you can get the official slow. But the latest to do an EM rotation, I mean, January, even I did one in February, so not that big of a deal. But I also didn't expect that to produce a slow, because I don't believe that the slows that you attach to your application late always make it in front of anybody's eyes. So I think it's best to have it in when you submit, and do not submit late. I mean, no matter how much that's been drilled into people's head, I still hear about people submitting late. Not a single day late. Do not submit late. You be there, like, even if it crashes, with your refresh button and submit when it's due or when it opens. Okay.
Good point. Okay, and the next part of that question was resources to impress. We're all kind of like writing them in the chat right now. I feel like Wiki EM is good because it's always a good reference. No one kind of judges you for not being up to date. Up to date is really wordy sometimes, and Wiki EM kind of breaks it down. In your free time, C3 was my recommendation for podcasts, but also if you Google like EM clerkship, they have a really good like interpretation of like something that will be referenced probably to you for your oral reporting. So a really good summary of that, and that is where you really can shine, and it's hard to get to the end of that presentation. So yeah, anything else on resources, Danielle?
Yeah, I think one of my favorites for sure was EM clerkship. I found it on Spotify. And there's a specific playlist of like how to crush your slows, and it's all about the like giving oral presentations. And I highly recommend listening to it, like maybe just binging that maybe a couple days before you start either your first or your second, or re-listen to it, whatever, but like try and do it before you go into your EM rotation, because I think it is so helpful to really put in perspective how the EM presentation runs and what's most important and how to really condense it to the essentials that you need. Because, you know, in different clerkships and stuff, especially with internal medicine versus OB versus surgery, they all want different stuff. And then EM's just kind of like way different. They want very specific things in a very specific format. So I think that's really helpful. Other resources, man, download MD Calc, okay?
Yes.
The
And don't
calculus-
present without doing like PE stuff for MD Calc, both of them. Go on, sorry.
Or you better know, you better know the heart score, like know that stuff.
Mhm.
Because I did a presentation, or like if I went to go see a patient and I knew, like, let's say it's chest pain and stuff like that, like I know I need to have up the heart score and calculate that. So I would literally do like a lap around the ED before I went to present to make sure like I looked at all of like get my whole differentials ready, make sure if there was something I needed to calculate, I calculated it first and then went to present. So that way it's boom on the first thing is like, okay, yeah, you have it all laid out. You don't need to tell them that you're using these resources. You can go have it in your pocket, pull out your app on your phone, do it. I did it around the corner next to the bathroom and then I'd show up and be like, yeah, the heart perk scores that, or they're perk negative. I think that is incredibly helpful. I still use MD Calc all the time.
Yeah, and they will be like, so what's a perk? What's a heart? And you'll stand there and be like, I was gonna calculate that. And they're like, that's great. So was I. Do it. But yeah, great points. Anything else for that one? Carla, you already got a chance, right? Sorry.
No, I just wanted to say, Danielle, I wish somebody told me to do that. Do one lap around, because my God,
Yeah.
seriously, it is way better to show up prepared than to just bumble out whatever the heck you're trying to read on your little scratch note paper. And it's early to have some scratch paper early on, or it's fine to have that early on, but later try it to not write down all of the presentation. I had somebody like task me with that, like, don't write everything down, see what you remember, and you will surprise yourself. You can remember a lot more about your patient than you think. And you don't necessarily have to write, especially in EM, like what's going on with their like social life and their sexual history. And you really have to start focusing your exam, because this will really make you shine as far as like, you understand that EM is focused. You understand that you have to kind of change the way you present. And you understand that you can recognize a sick patient versus not sick patient. Like if the patient is sick, make that come across in your oral. If the patient's not sick, make that come across, because that will really make a huge difference.
Yeah, those are really good points, you guys. And I would also say that they're used to seeing people mess this up. Like, even though I was like working with EM clerkship and the resources, I still blanked. Like, it happens. But then you, like she said, you'll surprise yourself. Like, I had a program director be like, no, I want you to see this patient, but I'm going to watch. And like, luckily I'd seen enough chest pain patients to know like all the things to ask for that were targeted. Like, you know, like ask for like unilateral leg pain, family history of blood clots, not just personal history. Like, and they were like, all right, you got this. But like, had that been my first week, that would have not gone the way it went. So it's okay if you blank on things. So that happens, but just try not to get too anxious about it, and just try not to make the same mistakes twice, because they do appreciate it when you learn from what they're telling you to learn from. Okay. I know somebody wrote how many EM ways to do, and that's kind of dependent. Like, you guys have probably heard from us now that we had a couple different like regulation sets depending on our home institution, whether we're orphan status and the pandemic. So I don't know exactly your guys' regulations, but definitely you can check with your school. I know that I went to a program director because we had like a meeting for like our halfway through the rotation, and I was like, hey, I already have an away and you're going to be my next away. I just want you to make sure that's normal. And they were like, well, since you're in an orphan status program, we're prepared for that. We know that. So it's more anxiety inducing for us, I think, than for them. But you can definitely talk to either your mentors or clerkship directors and find out how many to do. But I enjoyed being on away rotations. So don't do so many that you're going to be super burnt out, because you do get burnt out. And fourth year in general, you're like, finally, no one's asking me to do tests all the time and do this all the time. So it's easy to like want to relax. But yeah, so anyone else want to add something to how many EM away rotations? Because we still have a couple questions to get through. If not, then I'm gonna go on. Okay, if my medical school is located in the state that I do not want to do my residency training, how can I best optimize away rotations? Good question. I will answer after everyone else. So the question is, I don't want to practice or do residency in my state. How do I optimize the situation? Anyone? Or Danielle, let me start there.
So I wanted to do my away rotation in a different location, to kind of expand my options, and, like ties, I guess, when I was applying. So what I did, a lot of the programs that I applied to, required a letter of interest. And so because of that, I had to, this was a way to force me to get started on my personal statement, because I was not doing that otherwise. But the way I tried to format it was the first 2 paragraphs really spoke about, like, just gave a brief overall summary of like why EM is so important to me. The second one is what I plan to do in EM and like where I see my trajectory going, my career, that kind of stuff. The third one, and this is where I changed it for every letter of interest, was based on why I'm interested in this and why and what I want to do. This is why I'm interested in your program. Like, I'm interested in X, Y, and Z because I want to learn more about X, Y, and Z related to my career trajectory. I want to meet with this person. Like, I did research to be very specific for every letter of interest. And so I think that really helped. Who knows how much they read it? I don't know. But in case they did, hopefully that gave, I would like to think that gave me some reason why I should be considered in other places, even if I didn't have ties there. But if I did have ties there, I for sure used an excuse to be like, hey, I got family in New York. This, I'm really trying to go back to there. I'm from California. And so when I was applying to like California programs, I say like, this is home for me, that kind of stuff. Like, I really threw that in there just in case they actually read it. So, so that's how I handled it.
Nice points. Carla?
So I showed interest to like out of state programs without actually going out of state. I was limited. I have 2 smaller children, so I didn't want to take them with me. It just wasn't going to happen. So I thought it was kind of hard for me because I didn't do an away rotation. So I thought that in retrospect, I should have like gone and done some, legwork to show some interest in some of these programs. But I will say now I've been given some advice that I can now pass along to you to help you get some of these away rotations. But there's a super popular person on Twitter, Gamer EM Doc, and he specifically told me we look at candidates from 3 different residency fairs. We look at PACEP, EMRA, and ACOEP residency fairs. So a lot of these fairs are virtual. If you have not passed the dates on these fairs, make sure you have them, and I'll put them in the chat. Make sure you have them on your radar so that you go to these fairs, and they always have question and answer periods, and you can direct message these PDs directly. And they do, they say, we don't give favoritism. We don't, have a list of, they do, they absolutely do. So they will write your name down, and they will say this person, showed interest at this fair. So this is a legit person to look at, pull their application. Does it fit our criteria? Otherwise, they have no idea you're interested in that location. They have so many applications to go through. This PD specifically said we have so many people to look through that we look first at in-state and then surrounding states. If you're not a surrounding state, they may never even look at your application. And some of these people and some of these programs are amazing programs, and specifically reaching out to these programs is all they ask for. So if you have a place in mind, if you have connections or not, go for it. It will get you more interviews. I specifically got an extra interview just by reaching out. So you definitely reach out however which way you need to reach out. But I will say I also joined Twitter just for the med Twitter atmosphere, because for EM, it's like out of control. It's like everyone's on there. So just do it. I'm not somebody who even does anything on Twitter, but you get a lot of information, you see who's a big deal, you see the program directors who are putting themselves out there, and it kind of gives you an idea of what programs are really actually good programs for residencies. You yourself could find your interest just based on who's putting themselves out there and what their interests are.
Yeah, that's a good point. And Courtney, I see your question about repeating those. Carly, would you put those 3 names in the chat?
Yeah, I'll put those fairs on there.
And I only went to, I think, one of those, but I wish I would have went to more. I wish I would have been so like anxious to not just start like meeting up with people on those or meeting up with programs. I think those are good. I did a lot of those like open houses, which I think was good because I could write in my update letter. I think I wrote to an Arizona update letter or a program for an update letter where I wrote them, didn't hear back. A month later, I like called and left a message, and I ended up in January getting an interview there. So I don't know if that played a part, but for the amount of work that you may be putting into like writing these updates and calling them, don't try to drive yourself crazy. Somebody gave me a really good piece of advice, like, yeah, reach out to programs, but you already shot your shot. I think they said, like, don't go nuts. Like trying to like reach out to every single program you haven't heard, because it'll drive you nuts. But you definitely can show your interest in the top 10 or even 15 if you like hadn't heard from some of those. I will also say on top of that, somebody gave me really good advice about what was it about, like, yeah, adding Twitter, but I like heard like you can connect with them and find more out about a program. There could be 2 programs that are really good, but only one of them are good for you and what you're looking for, and that's kind of what I see in some of those differences in what they're posting. Okay. Oh, right. To add to the out of state thing, I heard, and this is how I did it. I picked for applying to a ways, like I looked at the different regions outside of my state, and then I applied to like a handful in each region. And what I got back was like a Midwest away and like an invite for a Southern away. So you can do it that way, that you're kind of like spreading yourself out across the different regions. And then sometimes you'll get an invite based on the fact that you've gotten a letter from a certain region. So I would say that. Excuse me. Was it difficult obtaining a SLO from the attending? Were you allowed to assist with any of the okay, so first, was it difficult getting a SLO? Anyone?
Nope, not for me. They, at least at the places that I rotated at, they had mentioned it during like orientation day, be like, this is the person you get your SLO from. I feel like, I think especially if this is not the first time that people have rotated through their ED and stuff, they usually have a person that's designated for that role, or like they'll explain to you how to go about asking for your SLO and whether it'll be automatic, if there's a specific person assigned, or you choose who it is. Like they'll lay it out for you if this is not their first time. They already know what to do.
Yeah, I was pretty forward about it from the very first day. I was just like, I'm EM bound and I will be asking you for a letter of recommendation at the end of this. Just so I knew if they didn't know or they weren't interested in writing letters, some places just don't like writing letters, that I was aware of that, because I had them in my head as a definite letter. So it's good for you to know if you're going to need a letter, because they're not going to give you one, either because they don't have time to write them. And that's fair. If these people don't have time to write them, that's fair. But also, like you were saying, Kirsty, if they don't have time to write it, but you were counting on that letter, just tell them your situation. People are really nice.
Yeah. I would also say she put a good point out that we hadn't mentioned before. Tell them that you're interested in EM. Make it known. Ask for feedback at the end of every shift. And, because like I'm EM bound, can you give me any like feedback whenever it's convenient? They actually like usually EM bound people because they want to see what you can do. They want to like share in that enthusiasm. I was one of the last people doing away rotations at a certain site, and they were like, I'm really bummed because next month we're just gonna have people that don't want to be here. But they like you. So just don't mess that up, because like they already want you to be there. They're not gonna handhold you necessarily, but like they want you to do well if you're EM bound. And don't wait till the last minute to ask for a letter. I told you guys the one story that was difficult of getting the letter at a community site, like non-residency one. I also told them that like the other guy that was saying no originally was like, I have only had a couple shifts with you. I was like, I'd be happy to like ask the other attendings if they would help write it. Like try to problem solve with them. So you're not coming back as like saying like, but I want one. Like try to like come back with like, hey, I thought about what you said. It's a really good point. And I actually brought it up the next shift where I was like, but I thought about these 3 ways we could get this done. And I like am like 2 weeks out of finishing my like rotation. So I gave them enough time to consider it. Okay. Moving on. I want to make sure to be respectful of everyone's time. So we finished, but we still have a couple more. So the other thing, will you be allowed to assist in any procedures like suturing and intubating? So yes, I'm just going to jump in and try to be fast, but yes, suturing for sure. It got to the point that they were like, are you comfortable suturing this? Go ahead. They watched me do like the first stitch. And if I was comfortable, they let me finish. So I think I sutured like at least 10 or 20 things from a lot of faces. Also, if you ever get a bleeder, just put pressure and don't freak out and wait for a bit, like 5 minutes before you try to get somebody in, like if somebody's like squirting blood. And intubating, unfortunately, I didn't get a chance because I was always in the position of like, you'll intubate the next one and then it like wouldn't happen again because they want to do like show one, teach one type thing. But yeah. Anyone else want to talk about procedures?
Yeah, I think it depends on the regulations that the places will have, but if you're interested, definitely be like, hey, I would love to do this. And I think the more that they see that they can trust you, the more that they'll be willing to let you do some stuff. Because during my away rotation, I wasn't able to intubate. That was for the residents, but I was able to suture, was able to do a paracentesis. Like I helped with the central line. So I got to do a lot of really cool things, but that wasn't until much later in my training when I had established the amount of trust as a rotator.
Absolutely. And like she said, tell them like, and then people will grab you from different areas or like say like, go over there and look at that. Like, so even if you're not hands-on doing it, you're right next to the person doing it and they're teaching you, or you're learning also from what they're seeing. That's a struggle and it's all valuable. Carla, anything else?
No, I think you covered it all.
Really good. Also to listen to at least like one podcast or have like a suture understanding, like no, like 5-0s or even less are like good for faces or like the thinner is good for the face and like what kind to use. Is it Vicryl? Is it ethylene? Ethanol? Sorry, I don't know what's with me today, but kind of know that because they might come back to see how ready you are by saying like, what would you use? So kind of have an idea. And even if you're wrong, if you're in the ballpark, that's better than being like, I don't know, like have a plan. All right. What are some criteria like Chad Bass scores that we should definitely know? I would say MD Calc we already reviewed. PERC is one. What do you guys want to throw out there?
Well, score for
Yeah.
Ottawa, ankle rule for x-rays.
Yeah. Hard.
Next is C-spine. I'm literally looking at my favorites on MD Calc right now.
Yeah. So am I.
Exactly. And like you can, sorry, go ahead, Carla.
No, go ahead. I'll throw out a couple
like
when
I
I hear
remember doing Nexus C-spine and then I was asked in a different rotation like weeks later what is like the Nexus C-spine, and I could only remember 2, but the fact that I like had that experience will carry over to like you'll just find yourself evolving. So it's okay if you don't get it your first time.
I'm just gonna write mine in the chat because there's so many.
Yeah. And they'll bring it up like and yeah, just MD Calc is usually 90% of the time where it's at. All right. Any recommended reading sources or conditions to prepare for prior to day 1? Any specific supplies or tools recommended? Since we went over some of this, I think it's a great question or set of questions. I'm just going to think of things to add. I think 3 times it was very good that I had suture scissors or just trauma shears, because a lot of the times like people that are there kind of start losing their equipment and they don't carry as much. And when you have that, when attending is there and they need it, it's really valuable. So that's one thing that's always good to have if you guys have it.
I mean, this is not prior to day 1, but we talked about like the different podcasts and all that stuff you can list. I do think like knowing where things are at, knowing where the sutures are, knowing where the ultrasound gel is too. If you don't have your own trauma shears, know where to find them. So that way, if it's needed, you can be the one cutting the clothes off and stuff like that. I think those are really just figuring out where things are. So that way, as soon as something is coming in, you know exactly where to grab stuff, know where the warm blankets are, know where to get the food, know where to get water for the patients. all of that stuff is so important. May not
Yeah.
happen prior to day one, but learn it quick.
Yeah, I'm full of those ideas too. Like instead of just asking a nurse to or relaying something to a nurse, like they want water, I would always be like, hey, this patient wants water. Can you show me where it is so that next time you know to get it and I can get it for you? Because they're also a big part of who you're trying to impress. The staff as well. I mean, it's so weird that we always have to give the advice, like be kind to people, which is, I understand everyone's under stress, but like you haven't made it. So like you need to like, even when you've made it, just be kind to everyone. And those people that are not even nurses, like staff, security guards, they got my back because I knew their name or like I introduced myself or, and like little things that she mentioned, like I remember grabbing a wheelchair for someone just because I kept my eye out, where do they keep the wheelchairs? And an attending was like, where'd you even get this? And I was like, well, I saw that you got one from over there yesterday. And she was like, oh. Or like, don't just get the ultrasound, like put gel on the ultrasound, have the ultrasound ready to log in a patient. Those things are big deals that like you learn on the job. Carla, anything else?
Yeah, I will say that if you can set yourself apart by being really good at ultrasound, that's always nice. Like if you get into that, or if you are into that. If you're not into that, it's painfully obvious and you don't know what you're doing, don't do it. But if you are into it and you've got a background, like you were part of a club or whatever, do it. Like throw yourself out there. They don't know what you know. They think you know nothing.
Yeah. Or even ask if you see a resident's going to go ultrasound someone and you have the moment, be like, can I watch? Can you teach me this? Because when it's your turn to be the one grabbing the ultrasound, you might be like, should I do this view or should I do that view? And then that kind of makes you stand out as well. So that's good. Before we do last thoughts and like anything you guys wish you would have done that you didn't, luckily we got through everyone's questions. That was the last one. I would say recommended reading sources. I don't totally have other than ones we've already discussed, but I definitely think if you get a chest pain, have some working differential. One thing I heard is if they're old and abdominal pain, take that seriously because that is like a high morbidity mortality situation. And it was kind of weird when somebody was like, oh, you want to send them home? Like, we should definitely like get on that. And like, you're going to have those moments where you're going to feel stupid or feel like, but people are moving too fast sometimes to like be super kind. So just kind of stick with it and like, remember that you're part of the group and like, they want you to do well. And don't be offended when people are, let's say, quick with you or something. Yeah. So anything you guys for preparing for day one stuff? Anything else? Like,
I will second that, be able to receive criticism, because if you can receive criticism and you don't repeat your same mistakes, you're a teachable person. And those people are rare, believe it or not. And showing that you're teachable sets you apart as being someone they're interested in. If you make the same mistakes again and again and again, you're not learning. You know, you can take your notes, but read up on them. And a ton of people gave me this advice that after each shift, read up on just one thing you saw that day. And that's going to help you. That still is going to help me forever. So I took that one to heart. That one's a good one.
yeah. And if you don't feel like reading because you will be burnt out or tired or want to relax, you can listen to a podcast on that one thing or listen to something. Like you can find ways to integrate it. And then you're going to be learning as you go along. You're never going to be perfect. So don't try to be like, don't try to bring that anxiety of like, I don't have everything. A great thing that, and now I'm going to open it to like, did you guys do any or wish you would have done something different that you know now? Really late in my ways, I had somebody pull me aside. Actually, it was a guy. And he was like, I've noticed. And he's like, don't be offended, especially the women that come here as med students, they're overly apologetic and you don't want to do that. He's like, you, and he wasn't saying it because I was already being that way, but he was like, I just like to tell everyone that like, you already have made it. We already want you to be here. I know it's difficult, but he's like, just my piece of advice is like, don't be overly apologetic because only you are the one that's like feeling like there's a reason to apologize. A lot of the people around you, unless you make a bigger mistake, don't need you to apologize. And it just like wastes time. If that makes sense or resonates with anyone, like just remember you're worth something and like work hard, be enthusiastic and find your place. Like I remember a trauma bay where there was nothing to do other than to find tape. And so I was like constantly handing the trauma surgeon tape and the EM team tape, and they were doing like bilateral chest tubes. And like, that was the thing I could do for them. And so find a spot and fill a gap. And like, you don't have to do everything perfectly, but you can not be in the way by be useful. Anything else you guys want to add for last thoughts? Because we have a few minutes left.
I mean, we kind of touched on that. I really, in terms of the EM clerkship, with the How to Crush Your Slows podcast, I didn't listen to that, or I didn't know about it until halfway through my away rotation. So I had done my home rotation, and was halfway through my away, and then I found it, and I was like, oh my gosh, I really wish I heard that earlier. So I definitely want to capitalize on that. I definitely also want to echo what Kirsty was saying about like, do not be overly like apologetic. Like at the same time, be humble, but know that you are meant to be there. Like you are supposed to be there, and don't let anybody treat you like you're like not supposed to be there and make you feel less than what you are. And that's something that I wish I didn't struggle with so much in the very beginning, and then got feedback on my like confidence level and stuff like that in the beginning. And then but it was a reality check, and I had to build that up. And by the time I did my away rotation, I had to change my mindset and make sure that I was more confident, and it worked out.
I've always liked to ask different residents, what are those students that are really mess things up? What did they do? And it's those people that can't be humble. So don't be that person. It makes you look bad, and it makes your school look bad. If you can't go in there and understand that you are still a medical student, you don't know it all, and you can't, you just don't know how to be humble, that looks bad. So make sure that you have your ego in check if you have one, like a big one. And don't go in there and just overdo it. Being eager is not being a know-it-all. It's not the same thing. And if somebody invites you out for like drinks and everybody's going out, go to those things. Those are like mini interviews. They want to know if they can work with you. And if they can work with you, it'll come out during the evening when you guys are hanging out. So I heard a lot of students just didn't show up to those things. And those things are, they're extra points if you can go out there and not be socially awkward.
Yeah. I would say also, like, even though people are talking to you super friendly and like kind of like intern level, remember that like you don't want to cross the line where you kind of are easing up. Like you still want to be, you work hard all the time. Like you always are the one to be like, oh, do you need to sit down? Or like you don't want to be the one like sitting when there's an attending standing, like those types of things. Just be cognizant of those things, because you will start to feel part of the team, which is great. But you also want to make sure that like they know you're hustling. All right. And I would say have a good time as well. Like if you guys are like easy to get along with, they're gonna forgive the fact you're taking 5 minutes longer with a patient than some other people do, you know? And like, you know your vitals. So if someone tanks, which somebody did while I was talking to them, even though they were still talking, I said, I'm gonna go talk to someone, and like leave the room and go get someone, because they went from like 120 to the 80s, like, and you're like tachycardic. Like don't forget to like rely on like your situation too. Any final questions, thoughts, concerns from anyone in the audience or any of our panelists? Open moment. I'm going to throw my email in the chat, so feel free to email me if you guys want or have any follow-up questions. And you'll find a lot of support out there, so don't be afraid to ask. Even if it's like one of the residents or somebody that's an alumni from your program that's there, that's also really helpful. And just breathe, like just relax as best you can, because med school makes us all kind of crazy. And so 4-2 is your time to just also like be yourself on top of everything. So yeah, thank you guys so much for your time. I know we're 1 minute after, so feel free to go. I'll stick around if anyone has questions. I'm going to end the recording in the next couple minutes, but thank you to our panelists, and thank you to everyone for coming. I think that might be it. So I'm going to end the recording.